showing up, and now I recognize Ranking Member Dexter for her opening statements.
Thank you very much to the chair and to our witnesses for joining us today. This is our fourth hearing on this topic in this subcommittee in recent years. When Democrats were in the majority, we held a hearing to understand the opioid crisis and what the federal government should do to address it. Since then, Republicans have used these hearings as a platform to talk about the border. In each of the hearings, tribal leaders told the subcommittee in clear terms that in order to combat the cartels and the damage they do in Native communities, they need the federal funding they were promised as part of the United States trust and treaty obligations. That means real investment in law enforcement. That means real investment in addiction treatment services. What did they get from Republicans and Trump in return for coming to Washington, D.C. to testify about the crises in their communities? Proposal after proposal to take away their funding instead of giving them more of it. Here's just a few examples. DOGE is closing 12 Indian Health Services offices and facilities across the country. Closures that tribal officials warn would worsen health disparities for Native Americans. Bureau of Indian Affairs Public Safety and Justice is funded at just under 13% of total need. An additional 25,655 personnel are required to adequately service Indian country. The Trump administration's 2026 budget proposal requests a $900 million cut in funding for the Indian Health Service, which is already deeply underfunded. The IHS provides essential addiction treatment programs throughout Indian nations. The Trump administration's proposal fiscal year 2026 budget requests a 35% reduction in funding for the high-intensity drug trafficking area program, a program that assists tribal communities in reducing drug trafficking. There's never a good time to defund the tribes that are trying to fight off the cartels, but doing it now is unconscionable. The fentanyl crisis in the United States is one of the most urgent public health emergencies in recent years, and its impact on Indian country is especially severe. The fentanyl that's being trafficked on tribal lands is killing staggering numbers of people on Indian nations, tearing families apart, upending lives, and tragically adding to the historical trauma that is already embedded in these nations. Addressing addiction to fentanyl is achievable. For the first time since the 1970s, the United States is experiencing a decline in overdose deaths. We have seen a 26.8% decrease in nationwide overdose deaths from February of 2024 to February of 2025. A primary reason for that is the expanded federal investments in public health programs and the work of harm reduction groups who are using naloxone or Narcan, an antidote to overdose, to save lives. But while the national picture may be improving, we know that tribal communities are still being disproportionately harmed. According to the CDC, in both 2022 and 2023, the age-adjusted rate of drug overdose deaths was highest for American Indian and Alaska Native people compared to any other racial demographic in the country. The treatment and prevention programs run by tribes are effective and cost-efficient. I'm grateful to our witness, Chairman Anthony Hilaire of the Lummi Nation, who will help us learn about how with federal investments, community members can receive effective treatment for fentanyl addiction. Treatment can give people their lives back and what can ultimately save them. But it won't happen with hollow tariff threats and showy executive orders that give law enforcement authorities things that they mostly already had. Narcan isn't free. Neither is talented, caring staff at clinics or tribal law enforcement officers who frequently get paid less than their peers at state and local law enforcement offices. It requires funding, and funding our nation promised Indian nations in treaties. We have the money to meet their needs. If my Republican colleagues can find the money to give budget-busting tax breaks to their billionaire friends, surely they can find a fraction of that to help tribal nations with their fentanyl and sex trafficking crises, particularly when they invite tribal leaders to DC to talk to us about these problems. There are law enforcement jurisdictional changes that Indian nations need to help address cartels, and some do not involve new funds. I think we should see if there is a way for us to work together to address these requests. But until we address the massive funding shortfall, Indian nations will continue to struggle. Thank you, Mr. Chair. I yield back.